Good morning, everyone. Our project lead is Anthony James from Louisiana. Unfortunately, he's not here, so I'm here in his absence, and I am the PrEP program monitor and coordinator for Louisiana. And so what I want to talk to you guys about is the community as full partners in navigating for peer and PrEP activities. And the way that Louisiana did that was through a robust CAB and through social marketing. And so why we invested in the CAB was because we wanted to meet the needs of the young gay and bisexual men and trans communities, particularly of color, which is what this project is based on. But we wanted to promote community involvement as well as community leadership. So we thought that if we can create this community advisory board and build them as leaders, then they can go back into the community and share the information that we're giving to them, as well as help them be a part of the process and to ensure that we didn't make any drastic mistakes with this project, as well as to tap into their social networks. So what we wanted to learn from the CAB was what education and awareness activities resonate with them, because based on this group, some of them do different activities, but we don't know that being the health department, so we need someone who can give us that information as to what should we say, how do we go about doing it, what is the change and what's to improve, as well as what changes are currently occurring in the community. And then what we plan to do with the information that we collected was to stay connected with those individuals as well as adjust our programming, but to engage the priority population better than what had been done in the past, as well as improving awareness and confidence in the navigation in PrEP as well as into social services. And so how we recruited those individuals was we have our partner agencies. They recruited 3 individuals who either were accessing PrEP or they were receiving preventive services. And they would be the best ones that can help us build this robust in the CAB. And so we did that by holding monthly meetings to keep those young people engaged. And then we had a workshop with Kenyon. And the goal of that was to how to identify encounter PrEP skepticism, as well as having one-on-one interactions with either clients or people in the community. Now, I always tell people our partner agencies have gone through mandatory training such as undoing racism, race equity, and that way they can know how to be welcoming and create that environment for the LGBT clients. And this is what our CAB looked like. Our CAB has evolved over the process of this project, and we have really reached a group of young people who are eager, and they have really participating in making some of our activities come to life. And I think we have achieved the sustainability that we need to continue to move forward even once this project ends. And what have they done so far? So they provided input on metro area social marketing. So we have a contract with Kaiser Family Foundation. And we bring those ideas to the CAB. They tell us what works, what doesn't work, what adjustments we need to make. They have reviewed data, as well as provided feedback on recruitment strategies, community awareness events, as well as on focus groups. This is our PrEP 2.0 campaign. So initially when we rolled out PrEP, there's a pill to prevent HIV. So now we're trying to continue to have that conversation. So we're saying PrEP, yes. What's what PrEP? Let's talk about it. So it's continuing to have that conversation. These billboards are throughout the New Orleans metropolitan area. And now we're taking it statewide throughout Louisiana. So the next phase of our PrEP campaign is going to have individuals that are telling their story. So it'll be much more personal. And this is what the first campaign rolled out, and it was billboards, bus ads, shelters, different places that we thought the young people would be, as well as our social marketing through video. So Kaiser gave us this video with Phoebe telling her story. So we did TV ads, as well as Bob the Dragon illustrating what is PrEP and telling everybody that they need to know about PrEP. But however, we have faced challenges, keeping people involved and engaged, adjusting to schedules because everybody either was school, work, but I think we're at a place now where we are on the right track. And many months, of course, was spent on relationship building. It took us a while to get people to trust the health department, not necessarily the people that were the facilitators, but most health departments don't have the best reputation, so it's us cultivating a relationship with them and letting them know that it was a safe space. And our strategy to do that was conducting monthly meetings and meeting them where they are for us communication through text, email, Facebook. We have evening meetings, we provide food, and then we give them an incentive of $50 for their time, because that's them taking their time out to come and share with us and give us ideas. And then they were regular participants. What we have learned, though, they like to be involved. They should be compensated for their time, and they don't mind doing the work. But they don't want to feel like they're researched or being targeted. And so that was the goal of creating the CAB, was to take that away. And so we continuously build relationships and engagements, and we wanted, every time that we encountered them was to be fun and authentic. And we wanted to hear what they had to say. As well as prep promotion and service uptake, it took time for them to, once we trained them to what messaging we wanted to get out into the community, it took a while for them to get comfortable in sharing that same message. And this is how we began the journey with the CAB. So last year, they created an event called the 41st Dates and Friends. And so what they wanted it to be was fun and authentic, but it had to be an invite only. And so they did the recruitment. It was individuals who they felt needed to know about PrEP, and so they gave them an invitation. And it was speed dating, so it was a way for them to have a sexual conversation, but in a safe space. And so how they guided the conversations was based on they had bandanas. So this identified what type of activity you were in. Were you looking for love? Then you had a red bandana. If you wanted to Netflix and chill, you had a yellow bandana. If it was Bay and Me, you had a blue bandana. But we threw the PrEP navigators in there so they can still spark a health conversation, and so we can still talk about PrEP. But it was fun for them, and it was something that they wanted to do again. And so this is a picture of them. Looks like they had fun. So it wasn't just one event. Our goal is to continuously keep it going. And so they created another event, the CAB Presents Prep School. And so that was in January of this year. And this event garnered over 200 people because they had high-profile entertainers, DJs, and it was very school-based themed. So everybody had to come in the attire. I was the principal because, of course, I'm not the young person. But the goal behind it was to have the school setting upstairs, and then they had the party downstairs. So me being the principal, I gave out hall passes, and that encouraged the young people to go upstairs to get information about social services, about PrEP, but it was an incentive for them to get drinks. So that was the thing that took them to say, okay, I want to know what you guys are offering upstairs. And this was one of the performers. And then this is some additional photos. And this was one of our events that we actually garnered the Latinx group of individuals, and we had Miss Primavera, the lady in the middle. So we tapped into some areas that we hadn't tapped into before. But this is for anybody who's interested in collaborating or putting a CAB together. It's a great resource for an input to ensure accountability with what your health department is doing. But it takes time and a lot of trust building and mobilization within the community. And make sure that whoever the facilitator is, they are honoring the community's voice. They have patience, because you're going to need a lot of patience with the young people. But they have great ideas, and they come in ready to work, like hit the ground running. So if you can tap into those individuals, you guys can do some major work within your organizations, and that is my time.